Hello, this is Dr. TMT. I will be discussing diabetes in relation to fasting in the month of Ramadan, the guideline for safe fasting, and the treatment adjustment that may be necessary. So for the purpose of this, I will be using the following outline: introduction, risk stratification, the challenges that fasting diabetics may face, pre-Ramadan assessment, lifestyle modification, medication adjustment, monitoring of blood glucose during Ramadan, when to break fasting when necessary, and then recommendations for healthcare providers, and I will be concluding the topic. So as a way of introduction, we know that Ramadan fasting is an essential spiritual exercise for Muslims all over the world. And then generally speaking, every Muslim always look forward to this because of the spiritual belief that is attached to the month of Ramadan. So because of this, the Muslim diabetics are faced with the dilemma of wanting to participate in this spiritual exercise, and then as well as the challenges that is posed by their state of being diabetic patient. However, proper management and treatment adjustments can help a significant amount of diabetic patients in order for them to be able to participate in this all-important spiritual activity. This is not to say that everybody will be deemed fit to participate in this, but as we discuss, we'll be able to outline some of the people that can participate safely in fasting of month of Ramadan, and as well as those people that would like to exempt from going through this because of the associated risk to their health and well-being. So because of this, people that live with diabetes have been grouped into three categories in relation to fasting of a month of Ramadan. We have people that are classified as low risk individuals. These are people who their diabetes are usually well controlled, either by just non-pharmacological control, just dietary control, or those that are just on maybe single or twice doses of metformin. Then the other category are the people that we classify as a moderate risk individual as regards fasting the month of Ramadan. So these people, these include patients who are on oral medication, like those on metformin and other oral medication, and they are stable with their sugar control. Whereas the third category are people that are high risk category people. These are people with uncontrolled diabetes, like people like I saw a patient today come in with a blood glucose of above 500 milligram per deciliter. So there are people like this. Some you find them almost always they are coming with unrecordable blood sugar that every now and then you need to intervene, as well as people that are pregnant, diabetic in pregnancy. These kind of people are not, they are categorized as high risk people, and they are usually discouraged from fasting the month of Ramadan. Also, other people that belong to this category are people that already developed some significant complications of diabetes, like people that already developed diabetic kidney disease, and people that already have maybe people with heart problem as a result of coexisting diabetes with maybe hypertension. So what are some of the challenges that are faced by these people, by people that have diabetes and are willing to fast? Some of them include they are faced with challenges of risk of going hypoglycemic, and we know that hypoglycemia is one feared complications of diabetes. Is one of the most feared complications of diabetes that we normally want to avoid. We want to do everything to avoid it because it it can lead to very significant other significant health complications. It can even lead to death of the patient. So because of this, we are always doing everything to prevent this. So, and because of the fact that people outside the month of fasting, people have different ways of life. So changing it during the month of Ramadan could, as well as changes in their physiology as a result of fasting, can also make them to be liable to developing hypoglycemia, especially based on the changes in their system as against the medication they are taking. And this underscore the reason why it will become imperative for us to also make some adjustment in their medication, as we shall see shortly. So another notable challenges that they face could be as a result of could be hyperglycemia. They can also go into significant hyperglycemia because of the fact that some people will overeat by the time they are breaking the fast at sunset, or as a result of incorrect use of medication. So people can also develop hyperglycemia because of this. Also, another notable one is the problem. They can face challenges of dehydration. Depending, the climate differs from places to places all over the world, and in some places it can be very hot. In some places, the length of the day is very long, such that people fast for a very significantly longer period of time compared to some other persons in other parts of the world where their daytime may be relatively shorter. So all this put together could put people at a risk of hypoglycemia or hyperglycemia or dehydration, as the case may be. So what are those pre-Ramadan assessments that people are supposed to do? So it is generally advised that before the commencement of Ramadan, people that have been diagnosed, that have been found to be diabetic, or people that are even suspecting that what's going on with me, you begin to notice some of those symptoms that people have described in relation to diabetes. Maybe you are feeling thirsty more than usual, going to the loo more than usual, and all those other symptoms. So you may also want to be curious enough to check yourself up. Generally, it will be advisable for, in fact, everybody, all of us, as part of preparation for fasting the month of Ramadan, all of us will undergo our health check to be sure that we are physically fit, we are physiologically fit, and mentally fit, the same way we are preparing financially for this month. So we should put everything together so that we'll be able to have each free fasting of the month of Ramadan. So during this time, between 6 to 8 weeks prior to Ramadan, we are advised to go and see our healthcare professional, where they will review our medication. For those that have already been diagnosed, our medication will be reviewed. They will check our glycemic control, that is how good our sugar control is. So they may want to use a test like a glycated hemoglobin, which is going to check the sugar control over the previous 3 months. And for those that are just coming, they are suspecting that what's going on with me, they are feeling like maybe they may be having symptoms that may be suggestive of diabetes. This glycated hemoglobin could also help in this regard, because it's going to look at the blood sugar level, average blood sugar level in the past 3 months, provided every other thing is kept constant. That is, if this person does not have condition that will invalidate the use of this. So then another thing that is going to be done during this period is educating the patients. We want to educate them on self-monitoring, on how they could monitor their blood sugar, and the things that they should be doing and the things they should avoid, especially during the month of Ramadan, as well as in preparatory to Ramadan. So some of those things include, we want to talk to them about lifestyle modification, most especially about their diet. We want them to focus on the use of complex carbohydrates. So especially during Sahur, we advise that when they are taking sahur, it will be better for them to feed on food substances that are made of complex carbohydrates. These are carbohydrates that cannot easily be digested into the absorbable molecules of carbohydrates, that is the glucose, that can easily go into the bloodstream, as against people taking their sahur with maybe things like cake that are made of refined sugar, which can easily immediately get into the bloodstream and then shoot up the blood sugar to the level that we will not want. So all these are things that we are going to be educating them on, as well as the need for adequate hydration, especially during the non-fasting hours, between the time of breaking the fast, the iftar, and eating the pre-dawn meal that is called suhoor. So all these are important lifestyle that we need to remind them and emphasize their importance when they come for the pre-Ramadan assessment, as well as a lifestyle that include exercise. So we still encourage them to be able to participate in mild and moderate exercise, but we discourage serious aerobic exercise, and this will also teach them to hypoglycemia, even if they are the type that is already used to this before Ramadan. So what are those medication adjustments that that are necessary, especially for patients that is planning to embark on fasting the month of Ramadan? Some of these the list here is not exhaustive, because some of the other medications that are not mentioned here has been found to require little or no any serious adjustments. However, those that require significant adjustments are the ones that are on my list here, especially the metformin. So for the metformin, the total dose will remain the same. The total dose that has been found over time to be necessary for the control of individual patients' blood glucose will remain the same. However, the timing arrangement will be different. For patients that are take for example somebody that is taking 500 milligram twice daily, in this case it may be difficult to make any significant adjustment to the dosage. So this person will only benefit with regular monitoring. However, for people that are taking like TDS 3 times a day, like somebody that is taking 500 milligram of metformin 3 times a day, this type of patient now will still be needing the 1,500 milligram of metformin for blood sugar control during the days of Ramadan. However, the timing of the drug dosing will be set differently. So we will be encouraging this type of patient now to be taking 2/3 of the total dose that this person is taking for a day, for each day, 2/3 of it now during the breaking of the fast, that is during the iftar, whereas 1/3 will be during sahur. So likewise, for patient that is take for instance someone that is taking 750 milligram of metformin twice a day now. So we want to encourage this type of patient now to change because this type of patient is also taking 1,500 milligram per day. So we want to encourage this to change to 500 milligram during the pre-dawn meal sahur, whereas you will now take 1,000 milligram during the breaking of fast, the iftar. So for those that are on insulin, especially those with type 1 diabetes, for this category of patients, will be making some adjustments to their amount of insulin that they normally use per day for their blood glucose control. So the basal dose of insulin, that is the type of insulin that we use to mimic the way the body produces a steady amount of insulin throughout the day. For the purpose of this, we use those insulin like the glargine. Those long-acting insulin are the one we use for the basal metabolic insulin control, whereas the one they take before meal are those that we use to to prevent a significant rise in blood sugar after meal. So for the basal control, we usually reduce the dose by about 15 to 30%. So I think this is a simple arithmetic that anybody can do. If we are talking about reducing by 30%, we are saying that so we'll give 70% of what the person you normally take of those long-acting insulin. So some people take the longer-acting insulin in the morning and night. So there is also variation as to what the individual is taking in the morning and at night. But generally speaking, what we are saying here is that we will now reduce these dose now. The one that is taking of long-acting insulin at night and at morning will reduce by 15 to 30%. So somebody can just decide to stick to 25%. So that is like we are taking 25%, we are cutting down 25%, so the person will be needing like 75%, like three-quarters of what the person normally take of the long-acting insulin will now be what he will be needing for during the month of Ramadan. So that's for the long-acting insulin. So whereas during the one we use to control the level of blood sugar after meal, the person will still maintain this prior to taking the sahur and prior to taking the breaking of fast. Iftar, immediately after the person is about to break the fast, he will still apply this so that to prevent this excessive surge during this period, coupled with other precautions that we've talked about earlier. So for monitoring that these people need to carry out during the month of Ramadan, the monitoring of blood glucose for patients that have diabetes we include patients who advise them to check their blood glucose at the period before they take their sahur, that is before they take the pre-dawn meal, the food that we eat before sunrise in preparation for the day fasting. Also, we also encourage them to take measurements in the midday. So some people will say this is optional, but it's also good, and they should have a diary where they record all these readings so that we'll be able to spot easily if there is any changes or anything that is going on. So then also prior to breaking of the fast, pre-iftar, we also encourage them to be checking their blood glucose as well. So we believe that every diabetic patient should have their blood glucose measuring device, glucometer, which must have been has been certified by people that really know how to check and calibrate this glucometer, because it's one thing again to have glucometer, it's another thing for the glucometer to even be working well, and it's another thing for the glucometer to start misbehaving at a particular point in time. So it will also be a duty bound on us too, as patients and as well as their healthcare providers, to also educate them on this and let them know that the importance of also checking their glucometer and making sure that it's working optimally especially before this all-important month of Ramadan, because as they want to participate, if care is not taken, it can put them at risk of some of those complications that we mentioned earlier. So I will find the time to discuss these glucose monitoring devices and some of their downside that many people are not aware of on another time. But for now, just we can do well to ask our healthcare provider or from whoever we are seeking health information and healthcare from, for them to help us so that we will not be deceiving ourselves thinking that we are monitoring our blood sugar, whereas the blood sugar may not actually be well controlled, or it may just be epileptic. At least it may just, if the glucometer is not working properly, then it may not be reliable. Now, this is another all-important aspect of this. So based on consensus from people, from agencies, different agencies, especially in this Islamic country, they've sat down, they work out things, they research about people, diabetes people that are fasting. So they came up with this recommendation that when these people are advised to break their fast against every odds, whenever they will get this, it's advised that these people should quit fasting and try to seek health care. So one is when there is severe hypoglycemia, that is, if you check the blood glucose and is below 70 milligram per dl or below 3.9 millimole per liter. So this also underscore what I was saying earlier, the importance of having a reliable glucometer. If it's a glucometer that is epileptic, that will be up to date down tomorrow, that is not reliable, there is no how we'll be able to rely on it, and you'll be surprised that you use a glucometer, it gives you 90 milligram per deciliter, use another one, it gives you 65 or something. So what do? So this underscores the importance of having a good and a reliable glucometer that has been calibrated and revalidated for us to rely on. So likewise, whenever they develop severe hyperglycemia, if you take your measurement and is beyond 300 milligram per deciliter or 16.7 millimole per liter, is depending on the type of glucometer and the calibration of your glucometer. Some glucometer will give you the results in milligram per deciliter, whereas some will give you in millimole per liter. So regardless, we have all the values here. So at the same time, if you start feeling the symptom, especially the symptom are also very important for those people that are still the diabetes has not eaten so deep that they develop what we call hypoglycemic unawareness. Some people, even when they are going to their blood sugar is approaching 0, they will still not know, so they can just fall down and drop dead. So these are the kind of category of people that we see them, especially in some developed countries. You see them, they have some skin patches or some equipment, some machine, some mini glucometer that will measure their blood glucose for them, just attached to their skin. From this, they monitor their own blood sugar and ensure that they don't just go into hypoglycemia when they are not aware of it and die from it. So likewise, if patient develops symptom of dehydration, that is, you yourself know that you are just not longer yourself, beginning to breathe so fast, you're feeling dizzy, and then some people, if you are, maybe another person is perceiving some fruity smell like ketosis in their breath, then this indicates that this kind of person should discontinue with the fasting and rehydrate themselves and seek healthcare assistance as soon as possible. So there are some recommendations that has been made for healthcare providers, for we that are seeing people. I know in my own country, a lot of people now are helping us to see our patients because of the situation of things. Because the truth be told, people have been already discouraged from going to the hospital in most cases, because even when you go there, you spend a whole day. Some people go overnight to go and sleep in the hospital with the anticipation of wanting to see the doctor. At the end of the day, they may tell them that they've taken enough number of patients that the doctor are overwhelmed to, that they could not be able to see other people. And those that are even lucky to be seen, because of the way the whole thing is, the crowd, the non-motivating nature of the job at home, even the doctor that is consulting patients, like me and one of my friends always say, that will see patient without even having a second eye contact with the patient. Before the patient could say jack, you already give the patient medication, refill medication, without really interacting more to even know what are the concerns of this patient. So all these put together have discouraged a lot of people from wanting to go to the hospital, and this has pushed them to wanting to seek healthcare using some other semi-formal, quote and unquote, seeking assistance from other healthcare provider. Especially, we are all familiar with all those people that are referred to as doctor in the different streets, the chemists, the pharmacists, the laboratory person. everybody, even including the herbalists now, everybody is into it, and it's unfortunate, but we just have to at least let's face the reality. These people can also be useful. We can try our best so that we work with them, we give them the necessary information that they may need, so that they will be able to help the people that are now depending on them, as it will be difficult for us to quickly say we want to reverse the situation as it is obtainable in the other clime. Also, emphasis should be on hydration and balanced diet. The patients, because dehydration could be dangerous, and then if the patient is not taking balanced diet, this could also affect the height. So putting everything together, these are some of the things, that information that we want the healthcare provider, like we stated earlier, this type of diet that we want them to take, and then educating them on need for them to drink enough water in those long fasting hours, so that they will not be at risk of going into severe dehydration, which can put them into ketosis, especially those one with type 1 diabetes. It can be very dangerous. So without wasting so much of our time, I will be rounding up this discussion with this. So many diabetic patients, as everybody is always eager and willing to participate in fasting, many diabetic patients can fast safely with proper planning. We remember the category of people that we discussed earlier: the low risk people, the intermediate risk. Those one can fast with proper monitoring and and adjustments in their medications as well as their lifestyle. So, however, high risk individual should seek medical advice before they embark on fasting, and many of them, like we said, we discourage them from fasting. But if we think we've been able to reasonably optimize them and they are so much willing to fast, okay, we should give them all the conditions and teach them on what to look out for and when to break their fast if the need arises. Likewise, the importance of lifestyle modification cannot be overemphasized. Somebody that will fast, during breaking of fast, you put 1 gallon of all these carbonated drink, and everything will be there. Shawarma, name them. So all this, we should be aware of our healthcare challenges, and we should act accordingly. We cannot afford to compare ourselves with other persons whose the metabolism of carbohydrates is optimal. Those one can take anything and everything, and they will be able to handle them effectively. So let's emphasize this to people that are coming to us. On a final note, I would like to end by saying that the best of medicine is to enlighten people on how not to need one. So for any query or concern, or you have concern about healthcare or some information you want to get clarification, if you don't have anybody that is handy that can give you reliable information, to the best of my ability, I will answer any concern if you send to me at my spare time whenever I check my mail. So you can send your concern to my mail at drtmt@gmail.com. Thank you.